confusing. All right. We got Representative Jeramey Anderson with us now. He represents the Mississippi's District 110. Representative, good to see you, sir. Thanks for coming on.
Gerard. How are you doing?
I'm doing fantastic. All right, so glad you could make it. Well, the bad news is you were delayed by traffic, I expect. The good news is a lot of people coming to this thing.
That is correct. I'm super excited to see the turnout. You know, that's always a good problem to have.
Yeah, absolutely. I've been watching it steadily increase since we've been here over the past hour, but this is a great event here for Moss Point and the entire Mississippi Gulf Coast.
Absolutely, absolutely. We always look forward to having cruisers come down and share our beautiful city with us as well.
Yeah. So tell us what's going on in your world in this period between the sessions. You guys will be headed back up to Jackson here in January. What have you been focused on in the interim?
Yeah, we always take this time to kind of take a break for a little bit. You know?
Yeah, sure.
Still work has to be done. We're still trying to figure out what piece of legislation we're going to put forward. Lawmakers are hard at work in doing that. Two bills that are proposals that I'm going to be pushing is going to be based around banning junk fees for credit card payments.
Okay.
You know, you go to a restaurant and they charge you a little bit more to pay with your credit card or your debit card than with cash. So I'm going to be trying to get that, get a remedy for that. Also looking at expanding breastfeeding support for mothers. So those are two pieces of legislation that I'm really looking forward to expanding.
So what would that look like from a state perspective?
Sure. So the breastfeeding measure, we're looking at trying to get more insurance coverage for mothers who decide that they want to breastfeed, making sure that there are support systems outside of the hospital. Most of the time when you leave the hospital, you might get one or two extra checkups. We're trying to expand that for a couple more months. So we're working with some partners to kind of expand that access and expand services there.
Okay.
As far as of course, the junk fees, we're just looking to limit that or get rid of that.
So what do you consider a junk fee?
So the credit card fee, when you go to a restaurant,
yeah,
and you have two options. You pay with the card or you pay with cash.
Right.
If you pay with cash, you're going to pay more. They're going to charge you basically the processing fee.
Card, you mean?
The card processing fee.
Okay.
We're trying to get rid of that completely so that is no longer.
So essentially the card processing companies would no longer receive this revenue, right?
Well, they would still receive it. The business owner will eat that cost.
Oh,
as
so
the cost of doing business.
Okay, so you're mandating that the business eat that money.
Correct. You cannot pass that to the consumer.
Okay, I got you. What has the business community said about that?
We'll see. We'll see.
Okay, I got you. So what do you think about the federal government shutdown at this point?
You know, we always wish Washington could get along with each other, but, you know, that's wishful thinking, Gerard, honestly. But, you know, I hope that we're able to find a solution together. I mean, ultimately that's what we send them there to do, is to come up with solutions, not create additional problems. So we'll see if that actually turns into reality or not.
Yeah. Well, at this point, it continues, as you know, and there have been some reports this morning of disruptions in air travel with many air traffic controllers actually calling in sick. So that starts to cause a problem. Maybe the Republicans and the Democrats will get their act together.
Yeah, we can only hope. You know, at the end of the day, it's the constituency that bears the burden of that.
Yeah.
So we hope. We've got a lot of federal employees now working for free.
Yeah, that's right. They are currently reporting to work, and I think that's why some of these air traffic controllers said, well, if I'm not getting paid, I'm just going to call in sick.
And you can't blame them.
Yeah, exactly.
You can't blame them.
TSA as well.
Yeah.
They're required to work. Of course, they will get compensated once the government gets back open, but we don't know exactly when that could be. But in the meantime, they're possibly going without a check.
That's correct. And I actually have a friend who said that may not be the case this time. To where they're getting that back pay.
Really?
So, you know, we'll see how that plays out.
Okay. Well, yeah, I certainly haven't heard that. Have you heard anything from your colleagues about how the shutdown might be affecting state operations and state affairs? Have been any reports on that?
I haven't. You know, of course, it's still early, and, you know, of course, essentials are still funded.
Yeah.
So, you know, we don't really know. But, of course, Mississippi is super heavily dependent on federal dollars, so I'm sure there will be some impacts if it continues to linger on.
Yeah. You know, the subject, just going to check with you on this, the subject of Medicaid expansion was something that was hotly debated in the 2024 legislative session, but nothing was really done on that. Do you have any thoughts or concerns there? And we can talk about that on the other side of the break. We got a break right now. If you can hang with us.
Absolutely.
Okay, great. We got Representative Jeramey Anderson. We're in Moss Point, Mississippi. It's Cruisin the Coast. Stay with us. Mississippi for Cruisin the Coast, little 409. That refers, right, Rhino, to the displacement of the engine of the vehicle.
That would be correct.
Was it also a model, perhaps? Or part of the model name, I think?
I know it was a kitchen degreaser because they used the song for the commercials.
I do remember that. The 409, the degreaser. You're right. I remember when that was introduced, and they sure did. They used that song. It was pretty clever, I guess. But I think that was from the all-hit request line, too. Jeramey Anderson, member of the Mississippi House of Representatives, is our guest here. He represents District 51 here on, District 110, right?
That's right.
Got that right?
That's right.
Yeah, I apologize. I was reading for Senator Jeremy England, who represents Senate District 51. So tell us what all is encompassed, the area for the boundaries for District 110 there.
Sure. So the boundaries of District 110 is Moss Point and Pascagoula. I share Pascagoula with Representative Fondren. I also share Moss Point, the unincorporated areas with Representative Manley Barton. And Senator England is our senator, so you were almost right on spot.
You guys overlap somewhat,
do.
Senate and House districts. So, okay. So before we went to break, just talking about something, and the reason I brought it up is because, as you know, at the heart of this government shutdown is just the debate over the health care programs operated by the federal government. Of course, one of those, as you know, is gigantic. It's Medicaid. It is the largest federal health care program in terms of enrollees. It's a jointly funded state and federal program in Mississippi. The total funding for Medicaid is about $8 billion a year, last I checked, and about $7 billion of that comes from the federal government, and that's without expanding Medicaid to the able-bodied adult coverage group as provided for in the Affordable Care Act. But the House had a bill in 24 that made it over to the Senate. The Senate had one as well. They couldn't work things out, so Mississippi did not join the other 40 states, actually, who have expanded Medicaid. Is this something the Democrats are going to try to push for again? What do you think?
Well, I sure hope so. You know, I think there is a pulse within our caucus let me say there is definitely a pulse within our caucus to make sure that our most vulnerable Mississippians have access to adequate health care.
Okay.
And so we're going to make sure that initiative does not get lost in the shuffle. It's unfortunate that neither chamber could come to an agreement over the past several sessions, right? You know, it wasn't really just this past one. We've had these conversations before. We're not new to this. Now, we did get a lot closer this past session than we have before, which leads me to believe that there still may be an opportunity, and we must continue to apply pressure to our leaders to make sure that they are making sure that people have access to health care.
Well, as you know, the federal government covers 90% of that coverage group, that in accordance with the ACA, but the state's on the hook for the other 10%, which could be as much as a couple $100 million, 150 to a couple $100 million a year. Do you have concerns about that cost?
Always, Gerard. Always. You know, when it comes to the state and tapping into general fund dollars and things of that nature, because the state, I mean, people say the state has a lot of money. I don't see it. You know, I did not support House Bill 1 with the income tax phase out.
Okay.
We're the most dependent on federal dollars, and we're still giving money away. And we still have neglected what I believe are government responsibilities to protect and provide for our most vulnerable citizens, whether that be children, whether that be seniors, or whether that be our impoverished constituents or more impoverished constituents. So I do have a concern because I don't think we'll be able to make that up.
Okay.
So I do have a concern there.
Are you concerned about the prospect as I've heard from some Democrats, of the elimination of the income tax, even though it's being phased out over a series of years, how that might affect the state's budget. Has there been some talk about that, how that might leave us with not enough revenue to fund government?
Yeah, definitely. It was a debacle when it passed with some trickery from both chambers, and so I do think we're going to see unintended consequences when it's fully rolled out, and possibly even before, to where the state has to choose, which naturally we make hard decisions every day on what to fund and what not to fund. But I think those decisions will hit home a lot harder now that we have House Bill 1, even though it's being phased in.
The proponents believe that eliminating the income tax will spark economic growth and that would offset the loss of revenue. Do you share in that belief?
I do not. We passed the tax burden just to some other place. I don't believe that at all. We've actually seen that in states around the country where that has not worked. And so, I'm all for trying things. I'm not saying that Democrats have all the answers. I'm not saying Republicans have all the answers. And I'm not saying that some Republican solutions aren't good solutions. But what I am saying is we have to be better stewards of the decision-making process when we make sure that everybody has a seat at the table and all perspectives are being heard. And that's how we build better solutions for our state.
Gotcha. So you talked about two things in particular. The credit card fees was one, and then the other had to do with breastfeeding, right? Yeah. So anything else on your radar? Let me ask you about this. How about school choice?
Sure.
Where do you stand on that?
I'm glad you brought that up.
Okay.
School choice is definitely a no for me.
Well, that's the speaker's priority.
Right. It's
no
a no for me.
there.
It's always been a no for me.
Okay.
And that is, I think geographically, that has a lot to do with it. I represent Moss Point and Pascagoula. Moss Point is a B-rated school district and have made significant strides in improving education. Our high school is an A-rated school high school. Just next door, we have those same metrics in Pascagoula, an A-rated school district, A-rated high school. And so I don't see the need for that in my community.
Okay.
Now, I can't speak for others, but for me, it's a no because I think that would be detrimental and contradictory to the trajectory of our school districts here on the coast.
So just providing parents the freedom to choose the education setting that they think is best suited for their children, which is why I support school choice. You don't share in that view?
I don't, because they can always move to those areas.
They can?
They can, yeah. If you want to move to Pascagoula and put your
just
kid
pick
in
up and move.
Pick up and move.
So you're in a house and you got a 2% mortgage and you can go move to one with a 7% mortgage.
If you want to go and put your child in Pascagoula School District, you are more than welcome to do that.
Okay.
Other than that, or you can send them to private school. If you choose to do that, pay to send them to private school.
So you pay your taxes, but your taxes, in that case, as you know, would stay with the school, and you don't get any benefit from that. But you've made that choice to go to a private school. You oppose that.
You could go to the school district in your community.
Okay, gotcha.
But again, in my community, we have A and B rated school districts. So
Okay.
but again, if you
not
look,
as big a deal, you think?
Yeah, if you look outside of this district, I'm not sure. Like if you're in an F rated school district and they've been underperforming for 15 years, then you might have a different perspective.
How do you stand on just allowing a open enrollment public-to-public transfer? Do you have any?
I think that is a
that?
slippery slope. I coach soccer,
Okay.
and I think from an athletic perspective, you would have a lot of problems there.
Okay. Just because maybe of people poaching for athletic purposes
Absolutely.
is one of those?
Absolutely. You go to school districts with larger resources.
Interesting.
And
Okay.
what does that do for school districts with less than? What happened to those athletes? What happened to those students?
Okay. What about school district consolidation as a way to perhaps eliminate some of the administrative burden and overhead, the back office spending? You have any thoughts about that?
I think sometimes that makes sense, and other times it doesn't. And I think there's a lot that goes into that. Community buy-in, the resources available, making sure that if you are consolidating a district, that all of those students are getting adequate resources, that is not being sent into one specific area, that all students are able to thrive within their community. So I'm not against consolidation when it makes sense.
Okay. interesting, because I think that's going to get discussed as well. Anything else you want to talk about?
Just the city in general. Moss Point is an interesting place. It is a great place to live, to work, to play. And so I'm excited to see so many people come to our city and engage with the community here. We have recently really refound our fire here in the city of Moss Point with constituents attending town hall meetings and city council meetings or city board meetings in droves, trying to get information on what's happening. And I'm just hoping that continues here in the city of Moss Point. But my office is actually going to be launching an initiative. It's called Action 110.
Okay.
And this initiative is built to engage constituents and give them a structure to participate in our governmental processes. We're focusing on housing. We're focusing on civic engagement, education, economic development, and we're doing seminars for the community to make sure that they know about these things.
Okay.
It's going to be
just
in
stay
April.
more engaged.
Yeah, it's going to be April is the week that we're proclaiming that. And we're going to have activities throughout the week, webinars, voter registration drives, and then we're going to end on Saturday with like a community cookout.
Sounds
in April.
good.
So we're excited to launch that.
All right. Jeramey Anderson, member of the Mississippi House of Representatives, representing District 110, has been our guest.